My name is Tanya Watt, and I am one of the pediatric oncologists here at University of Texas Southwestern, or Children's Health in Dallas, Texas. I'm here today to talk to you about the possibility of participating in a clinical trial utilizing Fenretinide, Ketoconazole, and Vincristine for your child with relapsed or refractory neuroblastoma. This trial will include the use of 3 medications, the first one being a medication that's called Fenretinide. Fenretinide is a cytotoxic retinoid, so in the same family as Accutane, but has shown in our preclinical models and our mouse models, and even in our previous patient trials, that it will work even in people who have become refractory or resistant to Accutane. And the reason is because it works in a very different method, even though it's in the same family, but it has different properties, so it allows the neuroblastoma cells to actually be killed as opposed to just maturing the way that Accutane tends to. We have found that the combination of Fenretinide and an antifungal medication called Ketoconazole helps us to improve the plasma levels or the blood levels of Fenretinide in your child. And so this trial will utilize both the Fenretinide and the Ketoconazole in order to improve the blood levels of the Fenretinide. From our models that we've done recently, we have shown that the addition of the chemotherapy medication Vincristine will again further help us to improve the killing of the neuroblastoma cells. So these medications have all been tested previously, both in vitro in the lab and then in multiple mouse models using neuroblastoma cell lines, frequently from patients who have had refractory or resistant neuroblastoma previously. And then the combination of Fenretinide has been used in phase 1 and phase 2 studies, both in adults and in children, in people with multiple different tumors, but most specifically neuroblastoma. All of these have shown promise that the combination of Fenretinide, Ketoconazole, and more recently Vincristine will help to provide both stable disease or even control disease and induce some complete remissions in patients who have received multiple other chemotherapy and other multimodality regimens to treat their neuroblastoma. This group of medications will be given as follows. So we will start with the medication called Fenretinide. Fenretinide is an oral powder that can be either taken alone or can be taken with anything that does not contain high milk fats. So most of our patients previously have mixed it with oatmeal or mixed it with juices or Gatorade. It is taken 3 times a day for a total of 7 days. On those same 7 days, we administer Ketoconazole once a day, which is an oral antifungal medication that has been used for many, many, many years to treat different types of fungal infections. And then on day 3 of that first week, we give 1 single IV dose of Vincristine that can be given through your child's port or central line or whatever form of access that they happen to have. Following that 7 days, then we rest for 14 days. And then we'll resume the drug regimen again for the same sequence of 7 days. We will continue that for up to 6 cycles, so 6 3-week periods. And then at that point, if your child is continuing to respond very, very well, we will continue to discuss further administering the drug after that. As with similar trials, we will plan to repeat scans and analyze your child's disease after each 2 cycles of chemotherapy or medications to confirm that your child is tolerating it well and is showing at least stable disease or hopefully some response to this drug regimen.
Fenretinide oral powder comes in a large plastic container that should be stored in the refrigerator. In this study, Fenretinide oral powder can be mixed with any food or beverage as long as the food or beverage doesn't contain large amounts of milk fat. Acceptable foods and beverages include oatmeal, pudding, juices, and sports drinks. Whole milk or ice cream should not be used to mix with the Fenretinide powder. Here, as an example, we demonstrate Fenretinide oral powder being mixed in SlimFast nutritional shakes for administration. Shake the container and loosely measure the powder with the measuring scoop. A scoop will be provided with the drug. Use a disposable knife to level the Fenretinide powder. Please do not pack down the powder in the scoop. The scoop contents are then placed into a disposable plastic cup. Slim Fast is added to the cup and stirred with a disposable spoon. You may add additional Slim Fast as desired to taste. After drinking all of the Slim Fast and drug, add water to the cup to collect any remaining drug sticking to the sides. Then, drink this water rinse. Keep the scoop for future doses. The disposable cup, spoon, and knife should be discarded into a trash bag along with the gloves.
The 3 drugs have some side effects associated with them. The fenretinide we have found is relatively well tolerated in previous clinical trials. The major side effects can include some skin dryness associated with the administration of it, some photosensitivity, so your skin becomes a little bit more sensitive to light, and sometimes your eyes can become a little more sensitive to light. And there has also been a decrease in night vision that in previous studies has tended to improve as you move further away from the fenretinide and stop taking the fenretinide. Other things that we watch for but have not observed to be too much of a problem include some mild nausea, some diarrhea associated with it. We monitor your liver numbers pretty closely, especially in addition to the ketoconazole, which can also affect your liver numbers, and make sure that we don't see any signs of liver toxicity. And then in rare instances, we have had patients develop headaches, and so we'll watch for headaches pretty closely. There's a condition that's called pseudotumor cerebri that is relatively unusual, but can be associated with the administration of fenretinide. So all of those will be being observed quite closely while you're receiving these medications. Ketoconazole is an oral antifungal medication, and as I said previously, has been used for many years to treat different fungal infections and has quite a well-known side effect profile. And the addition of the ketoconazole to the fenretinide in previous studies has not demonstrated a significant increase in the side effects associated with the combination of those drugs. And then the addition of Vincristine, which, as we talked about, will be given on day 3. Again, we do not expect that there will be a significant change in the toxicity profile by adding in the Vincristine. We expect that many of your children will have relatively low blood counts starting this process, and do not expect that the combination of these 3 medications will affect your blood count significantly, but that will be monitored for very closely. There will be a few restrictions while you're on the study, so there will be a couple medications that we will ask that your child not take while they're taking this combination of medications, the major one being acetaminophen or Tylenol. And then if your child were to have a fever, we would choose a different antibiotic other than Rocephin, just because of some previous toxicity associated with a combination of fenretinide and both acetaminophen and Rocephin. And then, like I said, we will continue to scan your child every couple cycles and monitor and make sure that they are showing an adequate or at least stable response to this combination of medications. And we'll continue that as long as they are tolerating it okay and not having unexpected side effects associated with it. So I want to thank you at this time for considering this trial, and I would be happy to answer any further questions or talk to you more about it at any time. Thank you.